Hello everyone, my name is Yong and my matrix number is BM24110011. In this SSM video presentation, I'm going to talk about the specialty that I've chosen before, which is Pediatrics Pulmonology. So what actually does Pediatrics Pulmonology means? So Pediatrics Pulmonology is a medical specialty that focuses on diagnosing, treating, and managing conditions that affect a child's lung and respiratory system. Now let's move on to the anatomy of the lungs. The lung is an organ of respiration which lies in either side of the mediastinum. Mediastinum is a thick midline partition that extends from the sternum anteriorly to the thoracic vertebra posteriorly and from the superior thoracic aperture to the inferior thoracic aperture. Furthermore, the lung is surrounded by the right and left pleural cavities. The right lung is normally a little larger than the left lung because the heart takes up some space on the left side of the chest. In addition, the right lungs have three lobes which are inferior, superior, and middle lobes, while the left lung has only two lobes, which are superior and inferior lobes. So now let's see the physiology of the lungs. The first one will be trachea. Trachea is made up of 16 to 20 C-shaped cartilage rings with mucosal lining. Furthermore, it is lined with pseudo-stratified ciliated columnar epithelium and it is located in the superior mediastinum. It functions to allow airflow into the lungs, warm and humidify the air. And the second one will be the bronchi. Bronchi are the passageways that connect the wind pipe to our lungs. We have two main bronchi in our left and right lungs that divide the branch off into smaller segments like tree branches. There are three layers of the bronchi. The first one will be the primary bronchi, and the secondary bronchi, which is known as lobar bronchi, and the tertiary bronchi is also known as segmental bronchi. And the next one will be the pulmonary plexus. It is a region on the lung root where nerves enter and branch out to innervation the lungs muscle fibers, glands, and blood vessels. It located around the pulmonary arteries and primary bronchi at the roots of the lungs. In the lungs, we got two pleural cavities, one on either side of the mediastinum surround the lungs. Superiorly, they extend above rib 1 into the root of the neck. Inferiorly, they extend to a level just above the costal margin, and the middle wall of each pleural cavity is the mediastinum. The pleural cavity contains pleural fluid, which lubricates the pleural surfaces to reduce friction between the lungs and the other chest components. The pleural cavity can also transmit chest wall movements to the lungs, especially during heavy breathing. The pleural cavities are completely separated from each other by the mediastinum. Therefore, abnormal events in one pleural cavity do not necessarily affect the other cavity. Means that the left and right pleural cavities help to prevent the spread of infection. Another important feature of the pleural cavities is that they extend above the level of rib 1. The apex of each lung actually extends into the root of the neck. As a consequence, abnormal events in the root of the neck can involve the adjacent pleura and lungs, and events in the adjacent pleura and lung can involve the root of the neck. Now here goes the pleura. Pleura is a bilayer serous membrane with simple squamous epithelium, which covers the lungs. It protects and cushions the lungs by secreting a small amount of fluid that acts as lubricant so that the breathing process can go smoothly. There is two types of pleuras, which are visceral pleura and parietal pleura. The visceral pleura is innervated by visceral afferent nerves that accompanied by bronchial vessels, while the parietal pleura is innervated by somatic afferent fibers which are the costal pleura, is innervated by branches from the intercostal nerves, and pain would be felt in relation to the thoracic wall. There are 4 sub part of the parietal pleura. The first one will be cervical part, intestinal part, diaphragmatic part, and costal part. The biochemical processes in the lungs is the gases exchange. It is an external respiration which takes place in the alveoli. The oxygen is transported from the lungs to the bloodstream, while the carbon dioxide is transported from the blood to the lungs. The carbon dioxide in the deoxygenated blood has higher concentration than the oxygen, so carbon dioxide tends to diffuse into the alveoli. While the alveoli has higher concentration of oxygen than the carbon dioxide, so oxygen tends to diffuse into the blood capillaries. So from this, we can see that the gases exchange in the lungs follows the concentration gradient. So these are the features of the alveoli that enhance the gases exchange processes in the lungs. The alveoli is lined with simple squamous epithelium, which is one thick cell to allow efficient gases exchange. Furthermore, the alveoli is also coated with a film of lecithin, which is a phospholipid that acts as a surfactant to reduce surface tension so that the alveoli won't collapse. In addition, the alveoli also have moist walls, which helps gases diffuse and dissolve that so that they can diffuse more quickly into the alveoli. So this is the common disease of pulmonary disease that happens in child, which is cardiogenic pulmonary edema. Individuals who experience pulmonary edema, which is cardiogenic pulmonary edema, will experience shortness of breath, coughing out with difficulty, swelling in the feet, and also appear pale or bluish skin. The causes of cardiogenic pulmonary edema involve increased pulmonary capillary pressure, decreased plasma oncotic pressure, increased negative interstitial pressure, damage to the alveolar capillary barrier, lymphatic obstructions, and also idiopathic, which is an unknown mechanism. So here goes the treatment to treat cardiogenic pulmonary edema, which is intra-aortic balloon pump, IABP. So firstly, we talk about the placement. The balloon is inserted into the descending aorta, typically where the femoral artery. And then the balloon inflates during diastole, increasing diastolic blood pressure and coronary perfusions, and dilates during systole, reducing afterload on the heart. Inflation and deflation are synchronized with the cardiac cycle to optimize cardiac output and reduce myocardial oxygen demand. Well, for your information, helium gas is commonly used for this rapid inflammation or deflection properties. And that's the end of my presentation. Thank you.